Hi, welcome to this short talk on learner-centredness from our 5-minute of supervision series. My name is Matthew Links and I'm the discipline lead for medicine at Bond University here on Ugamba country on the Gold Coast. Supervision is primarily a relationship of care and learning that's centred on the learner, their needs and their development. Within this relationship, the supervisor's role is to create opportunity, observe practice, provide feedback. And there are very important roles for role modelling, good practice, motivating, inspiring and caring for the learner. The concept of being learner-centred is easy to understand but quite difficult in practice. It starts with the intention to care and foster growth and is similar to the issue of patient-centred care, where the patient's needs and interests comes first. This makes it a perfect fit for medical education. The goal is to guide the learner on a pathway of lifelong learning, and the tools required are those provided from the world of coaching. An important concept is that of an educational alliance where the supervisor and the learner are allies in promoting learning. Being learner-centred fits with promoting self-regulation of learning, where the goal is for the supervisor to become unnecessary because the student is skilled at a cycle of learning and practice that we call the 4P model. This starts with preparing and planning learning, then performing relevant tasks and skills, thirdly processing what has happened, and four, proving this through documenting of achieved skills and competencies. Processing what's happened depends upon reflecting on practice, but it also involves learning to self-monitor performance and to generate alternative practices for improvement. This translates into a process where the learner owns their own learning, and the role of the supervisor is to promote learning-centred goals, to elicit self-assessment of performance and align this with expectations through feedback, and to help broaden the options the learner identifies to learn and improve practice. The problem is that novices don't know what's important and they may not understand what good performance looks like, and they have a limited repertoire of improvement strategies. It's our role as supervisors to guide them. As you can see, learner-centred supervision is a very powerful tool for enabling lifelong learning. Here are some useful references. I would encourage you to think about how learner-centred your practice is and what you might change to be more learner-centred. We would appreciate any feedback on this resource. Good luck and thank you for your attention.